For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. That's Dr. Lederman, the radiosurgery pioneer's goal, too. Dr. Lederman is first in America, first in New York, first for you with body radiosurgery. Dr. Lederman hits your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic large or small cancers from head to toe. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Goals are best results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD, call 212-CHOICES, 212-CHOICES for a fresh second opinion. Most insurances, Medicare, Medicaid accepted. Not only super convenient, super. Broadway and 38th in Manhattan. To hit your cancer, see Dr. Lederman. 212-CHOICES. 212-CHOICES.
Welcome, everybody. It's the Radiosurgery Show with Dr. Gil Lederman, MD. New York's only Harvard-trained, triple board-certified radiation oncologist who brings you the latest cancer treatment news, interviewing world-renowned cancer experts, delving to special cases, and, of course, answering your questions. I'm Rob Redstone, broadcasting from the WOR studios in the heart of New York City. And now, please welcome Dr. Lederman.
Hi, good morning. I hope you're well. Great to be back. We had a new show last night. Some of you listened to the show. It was 9 o'clock Saturday night. So now we have a show 9 o'clock Saturday night, 9 o'clock Sunday night on WOR. It was a great show, lots of callers, and lots of good points raised, which we'll talk about during this show, and new issues as well, of course. Therese Crowley in the news talked about these Ebola virus and the people who are exposed to it and how vicious it is. Now, the United States has put in this screening. Well, the screening is to take your temperature. Well, imagine you're a sick person or exposed to Ebola in Liberia or Sierra Leone, and you want to get to America and American health care, and you know they're going to screen. The screening is to take your temperature. Well, you can just take an aspirin or a Tylenol. It will take your temperature down. I mean, this screening is nuts. It's another totally ineffective method of trying to find Ebola patients. And we talk about it all the time, how dangerous it is to be in the hospital when you have super bacteria, and the super bacteria lodge in people who are in the hospital. And it's nothing you do to get an infection. It's just that you're in the hospital. You've chosen to be in the hospital. Sometimes you choose, let's say, radical surgery for prostate cancer in the hospital versus coming to us, an outpatient center where there is no super bacteria. We don't have ICU. We don't give super bacteria treatment, and therefore we don't create super bacteria. In fact, I usually don't like to give antibiotics unless there's an absolute need. Why? Because there's fungal overgrowth of the patient, there's creation of super bacteria, creation of super infections, which are hard to get rid of, that you can spread, almost like Ebola. In fact, there's just an article that was in the Wall Street Journal that came out from the Centers for Disease Control, and they looked at doctors in hospitals who are unnecessarily prescribing multiple antibiotics for several days when one antibiotic would be adequate. They looked at hospital doctors and hospitals and tried to evaluate how often they overprescribe antibiotics. They evaluated in 500 hospitals, and guess how often doctors in hospitals overprescribe antibiotics when they should only be using one, and they use 3 or more. What percent of hospitals and doctors do that? 75%. They found 75% of hospitals overprescribing antibiotics, creating super infections, exposing people to medicines they don't need, costs they don't need, toxicity they don't need, and there's no benefit. So the study of infectious disease is interesting. It's interesting to see what our government's doing with Ebola, which seems to be a little bit too late, too little, too late, and I suspect we're going to see more and more and more stories. Now we have one case which dominates the news. I imagine in the months to come we're going to have, unfortunately, many cases dominating and probably paid for by you and me. There's another article in the Wall Street Journal this week that looked at another conflict of interest. And conflict of interest, why are conflict of interests important? Well, they're important to understand because often when you go to the doctor, you'd like to know that the doctor is working for you and that hospital is working for you, and it may not be the case. In fact, most cancer hospitals and big hospitals get tens of millions and hundreds of millions of dollars from the drug industry. Well, how do I know this? Well, I know it even my alma mater, which when I was there took no money, and now this little hospital, Harvard Medical School, Dana-Farber, is taking about $65 million a year from the drug companies, and you're telling me that that doesn't influence people's decision? I find that hard to believe. Anyway, the headlines in the Wall Street Journal are, this is from October 1st, 2014. You can look it up yourself, page B1. And I quote a story from Peter Loftus. Drug and medical device companies paid at least $3.5 billion to American physicians and teaching hospitals during the final 5 months of last year. In only 5 months, doctors and teaching hospitals got $3.5 billion. This is said to be the most comprehensive accounting of financial ties that critics say compromise medical care. Well, if you're getting $3.5 billion in 5 months, I suspect it might interfere with the doctor-patient relationship. A doctor is getting tens or hundreds of thousands of dollars from a pharmacy company may be influenced to use those drugs. I often have patients come to me and say, well, I went to XYZ cancer hospital and they kept on pushing chemo. And I said, why didn't they tell me to use radiosurgery with Dr. Lederman? Well, because Dr. Lederman doesn't take any money from the drug companies. We don't have $1 or $1,000 or $10. No, we don't take money from drug companies, device companies. Now, the figures come. How do they find out that there's $3.5 billion exchanging hands between doctors and teaching hospitals in only the last 5 months of 2013? Well, under the Affordable Care Act, there's a provision called the Sunshine Act, which requires manufacturers of drugs and medical devices to disclose payments to physicians and teaching hospitals each year. The database revealed some things, such as Roche paid $122 million to the City of Hope Cancer Center in California. Okay? $122 million by Roche for the City of Hope. Did they tell you that when they advertised what a great place it is? No, but they probably took the money to pay for the advertisement. One surgeon in Baltimore got $78,000. It said for food and beverage. Wow, that must be a lot of champagne. The push for greater transparency was driven, he wrote, by concerns that doctors' prescribing decisions are tainted by money and gifts they receive each year from these companies. Supporters expect Transparency Initiative to provide useful information to patients about the relationship their doctors have with industry and to curb the influence of payments on medical care. And they went on to write, actually, Alan Kutel, the director of the Pew Prescription Project, wrote, the financial relationships between doctors and drug companies and medical device companies are a source of conflict of interest. They have the potential to influence the care that patients get, and so there's a matter of interest to both individual consumers and to policymakers. Guess why we do not take money? At Radiosurgery New York, we're a private cancer treatment center. We do not take money from drug companies. We do not take money from surgeons. So what is our relationship? Our relationship is between the doctor and the patient. Stop. Period. The end. So when you come to Radiosurgery New York, it's a pure relationship between the doctor and the patient. We work for you. We accept most insurances, Medicare, Medicaid, most private insurances. So we get paid through your insurance, not drug companies, not device companies. There's not the conflict of interest. Our work is transparent. We are working to provide the best possible care for you. And that's why often when I tell people, think about getting a fresh second opinion, it's really a fresh second opinion, untainted by secret money passing hands. So it's there for you, and we want it to be for you, the best possible care for you. One patient called this week, a 91-year-old man. He called, and he has a PSA of 7.4, and he asked, what should he do? Should he do something different because of his age? Well, life expectancy in this country has been rising greatly. If you think about when my grandfather came to this country more than 100 years ago, the life expectancy was only about 50 years old. Now it's almost 80. Men and women who make it to age 75 can expect to be around for many more years. At 85, the odds are very good you'll be well over 90. Newborn boys should survive till 75, girls till 80. This is all data from the National Center for Health Statistics. People with good genes have lived in beneficial surroundings with good nature and good nurture are overrepresented in the population. The health letter points out that an 85-year-old non-smoking woman without diabetes who has no difficulty walking 3 or 4 blocks has the same risk of dying or living 4 years as a 60-year-old woman who smokes, has congestive heart failure, and can't walk a few blocks. So it's not about age. No. If an 85-year-old non-smoking woman lives as long as a 60-year-old woman who smokes, has congestive heart failure, and can't walk, it tells you it's not about age. So when should you get treated? Well, number one, it's you. You are the president of the United States of your body. You get to choose. We help guide you if you want our interaction. But for this man who's 91, he's made it to 91. He's very likely, he's probably more likely to make it to 100 than me. I would say that's 100% sure. If he would like to be treated and he has cancer, then that's his choice. And you can have treatment nowadays in as little as 45 minutes. One treatment for prostate cancer, brachytherapy at Radiosurgery New York. Heck, if a 45-minute treatment can cure you of prostate cancer, is it worth your while? I would say yes. And the treatment is easy, it's safe, it's very effective. So there's lots of options, and obviously the best is to come in, sit down, and stay a while, and we'll talk about all those options for you. But if you could have the chance between cure in 45 minutes, one treatment, versus dying a painful death, I think the answer is pretty clear. This is Dr. Lederman from Radiosurgery New York. We're at 1384 Broadway. We're a private cancer treatment center. We take your insurance, Medicare, Medicaid, if you wish. We work for you. There's no secret hands. And we're here to provide information to you. We have 6 programs every week. This is the Sunday morning program. We have another program tonight at 9 p.m. We're going to hear from some new voices about our work, and then we'll be right back to take your calls at WOR, our phone number. And we have Bob and Ed in the studio who are fantastic to take your calls. They are at 1-800-321-0710. 1-800-321-0710. Here we go.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. With Dr. Lederman, the radiosurgery pioneer, that's our goal, too. He's first in America, first in New York, first for you with body radiosurgery. We hit your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic large or small cancers from head to toe. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are best results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD called 212 Choices, 212 Choices for